Their study was designed looking at is surgery timing, is there a difference of doing upfront surgery versus trying to delay surgery, and it was surgery followed by Sutent versus Sutent followed by surgery. That study had very poor accrual. They were looking at progression-free survival, and because of the poor accrual, they changed their endpoint to look at progression-free rate at 28 weeks, and it did not show that there was any difference in progression-free rate at 28 weeks. But as a secondary endpoint, looking at overall survival, it was not powered to look at that. The patients who had deferred nephrectomy, meaning that they had the systemic therapy, and if they didn't have disease progression, they underwent surgery, versus those who had progression did not undergo surgery and could pursue second-line therapy if they were still candidates. What we did see is that there was an improvement in overall survival in those who had deferred nephrectomy from 15 months in the immediate nephrectomy to 32 months in that deferred nephrectomy. I do think that's underpowered to really show that delayed nephrectomy is beneficial, but I do believe that really sets the paradigm with the tyrosine kinase inhibitor era, that if you have patients who are going to do very poorly with systemic therapy and you're going to put them through surgery up front, some of those patients are not going to do well and they're going to progress rapidly, and then by the time they're ready for receipt of systemic therapy, they may no longer be a candidate, or they might be too frail, or they might just go to hospice. So I do think that that type of approach, delaying systemic therapy, re-imaging at 3 or 4 months, would potentially weed out some of those bad actors, get them the second-line therapy which they should be receiving, and maybe avoiding surgery altogether. Again, that's the secondary endpoint. It was only 99 patients, and the relevance in now the new era, which we call the targeted immunotherapy era or the checkpoint inhibitor era, who knows whether these findings are actually relevant, and we're looking forward to studying this kind of treatment paradigm in the new treatment era.